family first. I want to talk to you now. We talked about the 100-year-old gentleman. I want to talk to you now about the other side of this equation. And these are people who don't have much time to live. And what they did was they took a study from hospice patients, and they said, what were your top 5 regrets? We have to learn from this, folks, because this is an important part of heart health and lung health. So let's look at the top 5 regrets. Number 1, and not necessarily in this order, I wish I had the courage to live life myself, not the life others expect of me. I don't know if any of you have ever had that instance, but I myself have had that, okay? So let's learn something else that we need to be doing. And this is, you notice I haven't talked anything about a pill. I haven't talked about a procedure that I can do to help your lungs get, this is real stuff here, folks. Number 2, I wish I hadn't worked so hard. This was one of the number 1 regrets, mostly of men. I wish I hadn't worked so hard. I thought about that yesterday as I was with my family, and that was so true. The time I had with my family yesterday was priceless. I wish I had the courage to express my feelings. I wish I had stayed in touch with my friends. The friends that you have and the friends you're going to make in here, this is going to be something you're going to be thinking about, according to people that know, okay? When they're spending their last days, they're thinking about the friendships. Those are the things, and they're wishing they had called their friends from a long time ago. And then finally, I wish I had let myself be happier. I wish I'd let myself be happier. So I think it's important in terms of good cardiovascular health for us to find out the things that are important and put those in the forefront. And I think that's what this wisdom can teach us. Okay, so folks, are you guys ready to get your 7 minutes of life? Are you ready? All right, here we go. I need your participation. So in order to get these 7 minutes of life, you have to be able to practice the 4 quests. The 4 quests. And the 4 quests are a physical quest, a mental quest, an emotional quest, and a social quest. All right? So let's get some examples of these types of things, and let's see if we can get this thing done here. Okay, so the physical quest, what this is basically is things you can touch and see, and things you can touch and eat. So it involves movement. We talked about that. I ran over these points before. Movement, eating plants and wine, these are all things you can touch and see. Okay, so this is what I want everybody to do. I would like for everybody to, when I say ready, set, go, I'd like for you to raise your hands up in the air and put them down 5 times. And when you're done with that, I'd like you to raise your hands back up in the air to let me know that you are finished. 1, 2, 3, go! Woo! All right, give yourselves a hand. Good job. All right. Okay. Good. Okay. So you know what that is? That's physical resiliency. That's being able to do something beyond what you were going to do before you came in this room. Something physical. Really important. Something physical. All right? That was pretty easy, right? Okay. Relatively speaking. I know, but what you did, I like what you did though. I like what you did. What you did was you went up as high as you felt comfortable, and that's very important. You go as far as you feel comfortable. If you see somebody else, and this is going to be very important for our very end folks. All right? So thank you for teaching us. Okay, let's go to the next one. Okay, the next one is mental resiliency. Mental resiliency, we talked about having a spiritual purpose. We talked about having, a spiritualness about you in terms of living long. We talked about having a purpose every day, getting up. You got something that's driving you to do what you do. Okay, so how do we put this into effect? Also mental acuity. So I'd like for you to do one of 2 things. This time, I want you to either raise your hands, and not yet, but you're going to raise your hands, and you're going to snap your fingers 50 times, or you get another choice. Or, if you don't want to do that, you can count from 100 backwards by 7s. Okay, everybody, go. Pick which one you want to do. Either count by 100 backwards by 7s, or put your hands up, that's right. And once you're done, raise your hands up, let me know that you got. Okay. Okay, all right, very good. Good job. Okay, you guys are awesome. Okay? Okay, so now what that means. So what does this all mean? Okay, so mental acuity. This means your brain is a muscle. It's important for you to use it. It's like a muscle. You have to use it every single day. So by snapping 50, you were counting 59, 49, or 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, or using the mental acuity 193, blah, 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 blah. I can't go past 93. So, so anyway, mental acuity, very important.
If you lost count,
then that means that you've got to start over. But it's important to go ahead and get started. You may lose count at 93, but it's important that you have the will to go back and do it again. And the will to go back, that willpower to put those hands up and count down to, that's an important part of mental acuity. Okay? All right, what's the next one? The next one is emotional acuity, resiliency. And this is what I got yesterday when I was out with my family, and that's what I'm getting when I'm here with you guys here today. These forming local groups, you guys are all here to be supportive of each other. And I'm here today to be a part of that. So we are now forming a group, and this is going to help us to live longer, but it's important that we continue this group activity. And if any of you have interest in getting more active in this particular group, I would encourage you to let them know, because we're always looking for people to step up if you feel passionate about this. I mean, it's very important. So, so now we got a little exercise. I want everybody to think about babies. Babies. I think about baby animals. I want everybody to call out a baby animal. Let's see what we're coming. Any baby animal. Baby what? Baby puppies, okay? Anybody else? Any other baby? Huh? Rabbits, baby rabbits, okay? Kittens? Calf? Okay, guys, I got some baby. Hey, look, guys, look. Oh, baby elephant. Baby elephant. And look at this. Baby orangutan. All right, so having this is called emotional resiliency. Being able to bring up a positive emotion. Studies show that if you can bring up 3 positive emotions for every 1 negative emotion, you're going to add more years to your life. But you have to practice this every day. It's called the 3-to-1 ratio. 3 positives for every 1 negative. And you guys all know that can be hard to do, particularly when you're all wrapped up in the whole, disease process, whatever that is, or whatever that you're under. That can be very hard to do. So therefore you must practice, particularly when times get rough. Look at that guy. Okay. And then finally, we have social resiliency. And everybody remember this right here? 1, 2, 3. Put the fork down. Okay? All right? When you are 80% full, you got to put that fork down, give your stomach time to tell your brain. And then, of course, working less. We all have to cool our jets down. So, folks, I tell you, congratulations, everybody, congratulations. I have actually some math equations. Give yourselves a hand, Because you guys completely earned it. You totally earned it. You have earned 7 extra minutes of life, okay? So now, the question becomes, now that you have 7 extra minutes, what are you going to do with it? I got an idea. Since I've given you 7 extra minutes, let's wrap this thing up so we can get this going. Okay, so in conclusion, folks, what we learned today is that Michael Jordan played with me. We learned that stress is a huge determining factor, right, in everything that we do. So it's important for us, the things that we talked about, the people that are living the longest, those 9 points I was telling you about, that's calming those jets. We learned about inflammation as a the common evil factor, inflammation. The studies show that too much stress actually wears down your chromosomes. It actually cuts them down by all this inflammation that it creates. And doing things for other people, being of service, has been associated with lowering that inflammatory response. So being of service to other people goes a long, long way. We talked about the 9 keys to longevity. We talked about the 5 regrets. And then, now I put here, we've added 10 years to your life. This comes down to 7 minutes per day, okay? Because on average, if you were to do this, I'll just give you a little bit of the math. On average, we live to about 78 years on average. If you do this, the 4 resiliencies, like I told you, you can add another 10 years to your life. So that means you'll live to 88. And if you do all the math and boil it all down, it comes to about 7 minutes a day. 7 minutes a day. All right? All right? Very good. So, folks, with that, I'd like for us to, for those of you who are interested, well, first of all, well, we'll save the questions for the end. For those of you interested, I'd like to do a little stretching exercise here. Everybody game for that? Yeah. Okay? All right. Way cool. Do I have time? Yes. Good? All right, fantastic. Now, you know, anybody that knows anything about a good doctor knows a true good doctor has its own theme music, right? And so I came with my own theme music. Let me see if this is going to work here. Now, in these kind of situations, you have to ask yourself, what would MacGyver do? Hey, everybody hear that?
Yes.
Okay, all right, so now this is what I want you to do. If you want to stand up, you may stand up. If you want to stay seated, you may stay seated. No problem. If you want to stand up and then at some point be seated, you may stand up and be seated. But this can be done both seated and standing and seated. This is called Qigong. Qi stands for energy. Gong stands for work. I do this every morning when I get up. I also do Tai Chi because I've got to lower my jets before I get started in my office, a very busy office, very busy practice. My job is to bring calm and peace to the environment because that will bring the calm and peace out of my patients. So, the way this works is, what I'd like for you to do in your chairs, and if you can get so that you're not touching anyone by doing like this. It's going to be tough for you guys out here, but I don't want to make everybody move. But if you want to stand, that's fine. And again, you can be seated at any time. But if you're sitting beside someone and your arms are stretched out, just bend them like this so that you don't bang each other. That's all. Okay? Because I'm going to ask you to have your hands out like this. Very good. Okay. Okay. So for those of you. Sit, doesn't matter. Okay, good. Well, we've got some eager beavers today. This is good. Okay, so what I want you to do, Qigong, I want you just to have with your feet shoulders width apart. And the first thing we're going to do is we're going to allow the balloons. Does anybody see the balloons? The balloons are under your hands. I want you to let the balloons lift your hands up like this and sink to the earth. Good. Okay, one more time. Balloons lift. Up and sink to the earth. Very good. This time, because this is breath matters, we're going to take a deep breath in.